If you would like to tell us more about yourself and speak out, that'd be great.
Yeah, absolutely. And I have a little PowerPoint I'm going to pull up here, but so my name is Sarah Beckman. I'm a speech language pathologist, and I'm a clinical educator at MSU Denver, which is Metropolitan State University of Denver, which is right downtown at, on the Auraria campus. So yes, I am going to be talking about Speak Out today, but I am going to just kind of start and talk a little bit about just general speech therapy related to Parkinson's and kind of what you can expect and some of those symptoms that we notice with speech, voice, swallowing, and cognition. So we're going to kind of go through a little bit of that. I'll give you a little background. And then, yes, I am going to talk about a very specific intervention that sort of targets all those areas, and that is called Speak Out. So let me see if I can share my screen here, and we will get started on that. So can everybody see that?
Yes.
Wonderful. Okay. All right. Perfect. Okay, we'll go ahead and get started. So to begin, a lot of times, the first symptoms that people are going to notice with Parkinson's is those motor symptoms. So tremor is usually the first, one of the first symptoms people start to notice, and that can be in the hands, arms, legs. And we also see that slowness of movement, which can affect walking, but it can also affect speech and voice as well. Stiffness, which can typically begin on one side and then transfer to the other side. And a lot of people start to notice that balance becomes a little off balance, a little impaired initially. And so those are those common first motor symptoms that people start to notice. And the reason that that happens, or when that starts happening, is we have neurons that produce a chemical called dopamine. I'm sure you've heard this before. And they start to become impaired and or die as related to Parkinson's. And by the time that these motor symptoms appear, around 80% of the dopamine producing cells have been lost. So by the time that these motor symptoms start appearing. But those are also going to affect some of the things we're going to be talking about beyond these symptoms, which is those speech, voice, and cognitive symptoms, as well as swallowing. So to start with, I'm just going to kind of talk about each one separately, and also some interventions that you can expect targeting each one of those different areas. So speech and voice, what you might find or see initially with speech and voice concerns is a soft voice, slurred or mumbled speech. Some people have rapid speech, or the speech just runs together. Stuttering is one that I've seen quite a bit, actually, but only 1 in 5 people with Parkinson's may experience something called neurogenic stuttering. So it's related to the Parkinson's. It tends to be a higher prevalence in symptoms that are worse, or individuals with lower cognition. And 90% of people with Parkinson's struggle with their speech at some point in time. Okay. So another thing that happens is trailing off at the end of a sentence. So you may start your sentences nice and strong, but by the end, the voice is softer, weaker, and people aren't hearing the ends of those sentences. Inconsistent voice production is similar to that. So some days or parts of days, you may feel really nice and strong and clear, and then maybe another part of the day, the voice is not as strong or clear. A hoarse vocal quality is very common. And sometimes just a monotone voice. So the voice sort of lacks that interesting inflection that it used to. One of the things that happens with Parkinson's is something called a sensory deficit. So these are all symptoms that may happen with your voice, but you may not notice those, especially initially. And what may happen is you might just start noticing that people are leaning in when you're talking, or they may say what, or ask you to repeat. And to you, you're thinking, well, what's their problem? You know, I'm speaking just the same as always. But that can be that first sign that maybe there are some concerns with your speech and your voice. So there's definitely an assortment of interventions to work on speech and voice. So I'm going to be talking about not all of them, but quite a few. And one of the ones that I feel a lot of people, and I mean people with Parkinson's, therapists, doctors are familiar with, is one called LSVT. So that stands for Lee Silverman Voice Treatment. That's been around for quite a long time, and it has a lot of really good research to back it. I did some research for our talk today, and so I've got a couple reference slides at the end if you have any interest in looking any of these up, but I'll talk a little bit about research for these as well. But I have a study here, and it's by Pugh et al., and it's sort of a summary of a bunch of research for LSVT. And the findings in all of these studies demonstrated higher, I'm going to use the word intensity, which is loudness, higher intensity levels for people with Parkinson's following LSVT treatment when compared to people who did traditional therapy or no therapy at all. So there's definitely great research showing that LSVT works very well for speech and voice. That program, I'll just give you a quick overview, actually, if you're not familiar with that, but that is a voice therapy program that's typically conducted 4 days a week for an hour for 4 weeks. So it's pretty intensive. And then there's a maintenance period and refreshers built in. So I'm not going to go super in depth into that one. But I am certified in LSVT, and I can definitely talk about it if anyone would like to know. Speak Out is another therapy program for speech and voice. That's what I'm going to talk a little bit about later, because it's what we offer at MSU Denver. And again, I'll talk a little more about that. But I do have a study on Speak Out as well. It also has a lot of good evidence behind it, though it's fairly newer than LSVT. There's a study I have referenced from Watts, and their study showed significant increases in that intensity. So we're talking about loudness again. And those differences were found to maintain post-treatment, 6 months after treatment, and a year. So again, this was just one study. And the intensity gains ranged from 5 to 17 decibels, which is a pretty significant jump. That might take you from a below a conversational level to an intelligible conversation level. So it is a big jump, but I know that might not mean a whole lot in terms of points. But
Sarah, can we ask you questions?
Sure. Yeah.
Okay, I've had Parkinson's for 13 years, and about year 3, I did some LSVT training, but it seems to wear off. Is that something that is commonly found in training programs?
I'm going to say it's not commonly found, but part of all these programs, and we'll get to it too when we talk a little more about the requirements for Speak Out, is that you have to keep up with the practice. When we talk more about Speak Out, I'll talk a little bit how that maintenance is embedded into it. Because our goal is to continue to keep you on track and to keep you practicing and check in with you and make sure that you are maintaining. And I'll talk a little more about that.
Okay.
LSVT has group options, but it's not something that is required. But one thing they do offer, I know, is refreshers every, I think, I'm going to say every so often because I don't know the exact time frame, but I think it is around 3 to 6 months as well, where they, you should be checking in with a speech pathologist to make sure that you're maintaining. So
Okay.
I will get to that a little bit more.
Thank you.
One, moving away from voice therapy interventions a little bit, is something called expiratory muscle strength training, or EMST. So that's what that looks like. There's a little picture there, but I have one handy. I brought to show you all, just for size comparison too. It looks like this. There's a little knob that turns, and what it does is it creates a different threshold that you blow into. And what these devices do is they work on strengthening the muscles involved in respiration. So you have expiratory muscles and inspiratory muscles. And so a lot of times with Parkinson's, the breath support becomes impaired, and this helps with that. Breath support is really important for speech and voice, in terms of intelligibility and then just the quality of voice. So this is also a device that's got a lot of great research behind it in terms of improving breath support for speech, as well as swallowing. So you're going to see some of these things listed more than once because they can help more than one area. Continuing with intervention for speech and voice, this is more of a strategy, but voice amplifiers is an option for some people. Let's say you were still working and hadn't noticed a lot of changes to your voice, but you still needed some help. These are good options, if you were speaking to a big group of people, a large room, to help kind of project that voice up and out. So these are just some examples. It's basically like a little headset with a box that helps increase your volume. And then another intervention, which is more of just strategy, but helps to improve intelligibility for your speech, would be things such as slowing down that rate, especially if you were an individual that tended to speak faster, and over exaggerating the words that you use. So opening the mouth more, kind of extending some of those sounds. Those can be strategies that help for intelligibility issues. So again, this isn't everything, but I hit sort of those main areas and kind of some of the more common interventions for your speech and voice. So we're going to move on to swallowing. Swallowing symptoms typically start with some of these areas that I've listed here. So drooling is one. With Parkinson's, the musculature starts to weaken. And so with the weakened musculature, the muscles for speech and swallowing are the same. So if your speech is starting to become slightly impaired, you might find that the swallow is as well. But finding, wetness in the corners of the mouth, or maybe just drooling while you're eating or drinking, can be an early sign of some swallowing concerns. Frequent throat clearing, either while eating or not, can be a sign. I often have people tell me that they're having trouble with their pills. So either just getting it down in general or feeling like they're just kind of stuck there. So that can be a sign that those muscles and that swallow aren't working quite as well. Coughing while eating or even after eating, could be a while after eating, can be a sign of some swallowing concerns. And I already mentioned the pill kind of getting stuck, but any feeling of, hey, there just kind of feels like something's there, that can just be a sign that that swallow might not be working the way it should be. And if you notice a wet vocal quality after eating, that's usually a sign we want to do some intervention at that point or give you some strategies for swallowing. So that's like if you're talking to somebody after eating and you notice it just sounds wet. So in terms of intervention, really the best thing to do first would be to do a swallow study. There's a couple options I have listed and I'll talk about them. But that's really a good idea because we want to know what's happening and we can't just guess. So a couple options. One is a modified barium swallow study, and that's typically done at the hospital or an outpatient facility that has x-ray, because you will typically sit and have an x-ray going on while you're being given food and liquid of different consistencies, and they're assessing your swallow. The other option is something called a fiber optic endoscopic evaluation of swallowing, or a FEES. That's something that I'm certified in, and it's basically, if you've ever been to the ENT, it's similar to what they use, but it's a little scope with a camera. We always say it's about the size of a spaghetti noodle, but it goes in your nose along the floor of the nasal passage, and then it hangs out right above your vocal folds. And then we do the same thing. We give you food, different consistencies of food and liquid, and we assess the swallow that way. Pros and cons to each one of those that I'm not going to go into, but that is usually the best first step if there's concerns with the swallow, because we want to see what's going on. After those assessments are done, there's a couple options in terms of working on that swallow. One is, we give everybody these strategies, but just strategies for safe swallowing, which are things such as sitting upright at your mealtime, at a table without distraction, trying to do smaller bites and chewing thoroughly. And oftentimes alternating liquids and solids can be really helpful with the swallow. There's also strategies such as postural changes, things like turning head different way, looking down, different things like that can help the swallow depending on what it's looking like and how impaired it might be. You also might find that you need exercises just to help strengthen up those muscles and that swallow. And again, those are sort of things we can't just guess. We have to see those swallow studies to determine what's going to work best. But the nice thing, again, about those programs we were just talking about, LSVT and Speak Out, is as we're working on strengthening those muscles for your voice, we tend to strengthen up those muscles for swallowing. So if somebody is just noticing kind of some beginning stages of that swallow concern, like the drooling or every so often feeling like something's getting stuck, we tend to find that they see improvements with those interventions as well. So again, I've got some research here for LSVT. I have a study that sort of summarized a bunch of studies that said the LSVT effect on swallowing showed positive effects on the physiology and symptoms of dysphagia, which is what we call swallowing disorder, as well as on cough function. So that sensory deficit I mentioned earlier also can apply to swallowing, in terms of you feel something there, but your body's reaction to want to cough doesn't always happen as easily as it should. because that is our body's reaction to food maybe going down the wrong way, is that immediate cough. And we want to see that. The improvements that LSVT had on swallowing, again, were maintained about 6 months post-treatment in the summary of studies that I have. In terms of Speak Out, because it is a newer program, it doesn't have as much research on the swallowing aspect. Research is being conducted. And again, I'll talk a little bit more because our university will be doing research as well on Speak Out. But again, based on what we know in terms of those muscles involved in swallowing, it's pretty safe to say that Speak Out will also help improve the swallowing function based on working on the voice and those muscles involved in voice. And also the patients that we've had that have had a little bit of complaints of swallowing have reported that their swallow has improved. So that's a little anecdotal evidence there. But I mentioned the EMST device. That's this little guy that I showed you earlier. Can't get it back out. There it is. So this device also can help improve that swallowing function. So I do have a study here as well from Van de Wettering, and it said it had positive effects on individuals specifically with Parkinson's disease. The expiratory muscle strength training improved the swallowing safety and the cough function, which is important, as I mentioned. All right, so moving on to some cognitive symptoms. About 50% of people with Parkinson's do experience some cognitive changes. This is not an exhaustive list, but some common ones are some challenges with executive functioning. I always think of that as how everything works together, but you typically notice problem solving, concerns with problem solving, decision making, planning, organizing. Those all fall under executive functioning. Language is a pretty common one in terms of word finding. I often have people complaining about that. Not a lot, but they'll say, oh, you know, I'm having a little bit more trouble with words here and there. Can't think of the name of something. So that one's pretty common. Comprehension would be your understanding, you know, of what either someone is saying to you or what you're reading even. And then memory is one that often I hear complaints about as well. So in terms of working on cognition, in my research, I actually found a study that said cognitive rehabilitation was effective for individuals with Parkinson's. It said it supported the fact that cognitive rehabilitation may be beneficial. However, they didn't have enough studies to see how that transitioned into like your functional daily living. So on the testing, they showed improvements, but they weren't sure how that applied to everyday life. So typically when we are working on cognition, we're going to work on strategies because that is effective. And I just kind of used memory here as an example, but we would work on external and internal strategies. External for memory might be something like writing information down, putting things on a calendar in a phone, setting reminders for yourself on a phone, you know, being a little bit proactive in that way. Internal strategies might be something like repeating information to yourself that you know you need to remember. That usually only helps with short-term memory. Coming up with associations. So I always, whenever I'm working with somebody, I like to use my name because it's Sarah. And I say, you know, think about what I do. So associate my name with what I do. Sarah's speech, that SS combination can help people. So things like that can help memory, as well as visualizing information is just another good internal strategy. I do have LSVT listed here, you know, and Speak Out. Both of these programs offer some cognitive, I don't want to say therapy, but there's some cognitive exercises built into Speak Out. I'll talk more about that. LSVT can include some cognitive exercises, but it doesn't always. It's sort of dependent on the therapist providing the therapy. Usually as the program continues, LSVT that is, they start to build in some cognitive exercises to help people increase, we call it the cognitive load while they're working on their voice. And so again, that may or may not be a part of LSVT. But Speak Out has cognitive exercises built into the program. And again, I'll talk a little bit more about that in a moment. And here we are. I guess this also would be a good time if anybody did have a question about anything I just talked about, feel free to ask. I am going to just kind of talk specifically now about Speak Out and kind of how it addresses all of those areas we covered.
A couple of questions I'd have. One would be the use of voice recognition. I've done a couple of studies, one with the University of Illinois, and where you say 600 different phrases, and it's just trying to learn how to catch what slurred speech probably would be the best, or slower speech.
Yep.
Little tricks of the trade that I've learned along the way. I do a fair amount of public speaking, and I'll put a button in my mouth to stop the drooling. Mm-hmm. It seems that, it doesn't dissolve. At least I don't think it does. It doesn't dissolve, and it keeps you're consciously keeping it, moving it around with your tongue in your mouth while you're talking, and it doesn't seem to interfere with my speech, yet it helps me not spit on the audience and other embarrassing things like that. Any thoughts on using artificial intelligence or AI for voice recognition?
I don't have a lot of background knowledge on it. It's sort of it's a newer technology that's sort of being designed. In fact, we have somebody in our clinic who is also, it's at, I think it's CU Denver has an assistive communication center. And so I don't know the name of the app, but it's something similar. It was an app and they had to record 600 phrases. That one was specific to dysarthria, which I don't know if I wasn't trying to get too clinical on this talk, but hypokinetic dysarthria is what happens with Parkinson's. Right. That slowed speech, those weakened musculature. And that's just the type of dysarthria that happens. So a lot of those apps, the one I know about is specific to dysarthria, that slurred speech. And yeah, they're designed to, as you said, recognize sort of those errors in the individual and then help them through the use of using the device speak. I think any type of assistive technology is great. I do think we want to try to, work on the voice and speech so people can use their own voice and speech. But those things to help supplement as needed are wonderful. Just like the voice amplifier to help supplement, I think that's great. But if we can strengthen up your muscles and get you sounding better and clearer, I think that's a good place. I think that's good to start there. There was a study that came out this week even about AI technology and voice even. So it's definitely an area that is being more researched and getting more use for sure. So
it-
an idea. Oh, go ahead.
I was just going to say it has big money behind it because all of the major companies that want you to use their service, Meta and so forth, are
Mhm.
very interested. They understand that there's quite a population out there that, for whatever medical reason, whether it's Parkinson's or just paralysis or anything else, that have a hard time communicating, and they want they want you to feel comfortable communicating so they can communicate with you, if you know what I mean, sell you something.
Yeah, definitely there's a lot of technologies out there that can be really great uses and supplements for sure. Yeah, but there's definitely, I think a lot of that depends on the person, the diagnosis, as you mentioned, and kind of also depending on what it is they have, kind of at what stage they're at too. Because we can definitely, in terms of Parkinson's and working on voice, we can definitely improve that voice, and we know that we can. So we want to do that first before, having somebody use something like that to
Yeah.
replace speech. Those are good supplements, absolutely. But we don't want to replace your speech and your voice.
Yeah.
Any other thoughts or questions? All right. Okay. So I am going to talk about specifically Speak Out. I am certified in LSVT and Speak Out and that respiratory training device, done a lot of education on and training on that device as well. But I'm going to talk about Speak Out today. So Speak Out program was developed by Parkinson Voice Project in 2005. And it is based on the principles of motor learning. And this is, they used a renowned speech pathologist, Dr. Daniel Boone, to kind of help them develop some of the exercises and protocol for this. So the goal is to help people regain and then maintain their speech and swallowing. And they want therapy to be accessible to everybody. So in 2022, last year, they started this campaign to reach America, in which they offered grants. I can't remember how many grants they offered. I think it was I'm going to say the wrong number. I think it was around 12. And the grants, that's actually what we were able to secure at MSU Denver. We secured a grant from Parkinson Voice Project. And what that did is it allowed us to become a therapy and research center for Speak Out. And so their goal is to make services accessible, which means we do not charge. They do not charge. They're a nonprofit organization, which is wonderful. And their goal is that I think within the next 5 years, there will be a therapy and research center in every state in the United States, which is really cool. So their premise is to use intent. So they use the word intent to move automatic motor functions to more intentional motor functions. So I'll talk a little more about that on the next slide and give you a good visual. And the program is comprised of 6 exercises that are designed to address your speech, your voice. There's cognitive exercises built in and swallowing exercises built in. So it's nice because it addresses each one of those. So I'm going to give you this visual here. We're going to talk a little bit about this. So to start, we were talking about dopamine a little while ago. That is produced here. I don't know if you can see my mouse, but it's produced in the substantia nigra. And dopamine is a neurotransmitter. It transmits impulses from one neuron to the next. And what those do is those help with planning and controlling your automatic movements. So what are automatic movements? there's a lot of them, but it's kind of those things that your body just does that you don't think about. So walking really is kind of an automatic movement. We often just get up and go. As you're walking and swinging your arms, that's sort of an automatic movement. I don't know that I've ever thought about that. Speech tends to be automatic for most. Swallowing is automatic, blinking. These are things that just kind of happen. And without enough dopamine, those automatic movements get disrupted. So you can see, I believe it's on your left side, that extrapyramidal system, that automatic system, all those green pathways. There's a lot of them. And that is true in your brain. There are so many different neural pathways. And so each time they have to go and stop and go and stop with dopamine disrupting that, that's what causes that slowness. It slows you down. It makes it harder. And so the goal of Speak Out is to move a lot of those functions to more intentional. And I'll give you an example of kind of what that means to hopefully make a little more sense. Driving for many is automatic. It probably didn't start that way, way back when you were a teenager and you learned how to drive. That was intentional. You had to really think about it. But over time, it became automatic. And if you have or have had a route that you drive frequently, you do it so often that you just don't have to think about it anymore. I know for myself, I've, my commute home, maybe I think, okay, well, I'm going to stop and, get something at the grocery store really quick. And then maybe I zone out and I'm at home and I forgot to stop at the grocery store. And part of that was because I was doing my path and I was on my way home and I wasn't thinking about it. But let's say you were doing that same commute and then all of a sudden there was a downpour on you. When that happens, you have to really then focus in and think about it so that you can safely get home, right? You might turn down your radio. You might put both hands on your steering wheel. You might lean forward a little more, watch the lines on the road. Those are things you might not have done before. You're really thinking about what you're doing and you're being intentional. And so that is the goal of Speak Out. And if you can see on the right side, that intentional system, pyramidal system, has got those blue lines that go straight down. Because what we can do is we can bypass all those stops if we really focus and think about what we're doing. And this can apply to more than just your speech and or voice. So the requirements of Speak Out is you attend an initial evaluation session, and we're just getting baseline information at that point and seeing kind of where you're at and where you need to go. They do have a webinar that's called the Learn About Parkinson's webinar. And when I say they, I mean Parkinson Voice Project. And they do this live once a month, and it basically just talks a little bit more about what I've talked about in terms of how Parkinson's and speech are, how speech is affected with Parkinson's and how Speak Out works on that. But it's something that they like to have, partners, care partners, family members, friends even attend as well, because a lot of times you do need that support when you're doing these types of programs. Then you would complete 8 to 12 individual sessions. So I mentioned LSVT earlier, and this is kind of where these two programs are different. This program is only requires twice a week for 4 weeks. And I didn't mention this before, but we offer both in person or virtual because Parkinson Voice Project wants, again, to make this accessible to those that maybe can't leave the home or can't, maybe they live on the plains or in the mountains and they don't have a speech pathologist nearby. So we offer both of those options, but it is twice a week for about 30 minutes. There are daily speech exercises that are required. You're going to find that anywhere you go. And then in your 3rd week of therapy, you transition into a weekly group. So we have groups and we put you in one And the purpose of that is so that we can keep checking in on you and make sure that you are maintaining, because that's the important thing. It's easy to kind of fall back into, not practicing every day, or, not using that new voice and thinking about it. And so we want to keep track of that. And then we do schedule refreshers every 3 to 6 months. And I'm going to show you the next slide here, because if that voice falls back or regresses in any way, what we do is we add in some individual sessions again and get you back on track. So they call this the circle of intent. Circle meaning it kind of never ends, keeps going around. So those are all the different areas I spoke about, 1 through 6. And then if you see that yellow ring around the outside, those are those daily home practice sessions. So you would need to practice during the program and after the program daily. And that is going to help you ideally maintain the voice that you, how the voice changes, whether it's, louder or clearer, more intelligible. We want to be able to maintain that. And I just kind of wanted to give you all an idea of what the exercises look like. If you've done voice therapy at all, you're going to notice some of these look similar, because in many ways, a lot of voice therapy programs have some of the same components, because we know how those exercises work and how they improve that musculature. So there are warm-ups that we start with every time, which helps coordinate that respiratory system with the laryngeal system. Laryngeal would be where your voice is. Sustained ahs, where you hold an ah. I won't do it for you, but that's part of the program. So that helps with that breath support. So we need that good breath support to be able to hold a sound or words for a long period of time. Glides, again, those couple ones are very common with voice therapy in general. So we want to stretch those vocal folds and get those muscles working with you. And that's what glides do. So we go, speak out is a little bit different. We don't want to go super low. So we usually start at your regular voice level, and then we go high, and then we go back down. There are number sequences. So we have you repeat some numbers back and string them together. And again, what that does is helps to work on that breathing pattern for speaking. So as we increase the numbers or decrease the numbers, we change it up, but it helps kind of work on that breath support and breathing. We do reading exercises, which helps to transfer those skills, getting into more conversational speech. And then the cognitive linguistic exercises are different tasks. Sometimes we do word finding tasks, categories. Sometimes we do math if we're being mean. No, I'm just kidding. But we do a bunch of different exercises to help you work on that voice while also getting that brain working and thinking. What's not listed here is swallowing. It's not considered part of the traditional 6 exercises, but we always end each session with a set of words and sounds that target the swallowing muscles, and most specifically the base of the tongue, back of the tongue area, because that's so important to our swallow, that area. So got a little bit of information here for you. If this was something you were interested in just learning more about, I put my phone number on there. You're welcome to call me. I would love to speak with you. And I say to get on our wait list because we're a university, we run by the semester. So we usually start new groups at the beginning of the semester. So for example, we just started our fall semester this week. So we have a set of speak out clients starting right now. And we can typically take people every six-ish weeks, new groups of people. As one group finishes, we start a next group. But because this is an ongoing program and we are here for you to help you, And when I say we, I mean our clinical educators, but because we are a university program, you would work with a combination of graduate students who are also trained in Speak Out, as well as clinical educators who are licensed SLPs. We work with you in between the semesters. Anytime there's a break, we are continuing therapy and making sure that you are getting that continuation of care. And if you just wanted to learn some more too, Parkinson Voice Project, their website is linked there. It's an easy Google if you need to do that. They have a lot of free resources, which is just amazing. They're quite a wonderful organization. One of their free resources I linked there is they have daily online speech exercises. So you could start that now if you wanted to. That there's no charge. They have them live Monday through Friday. You can just join, or they also have pre-recorded ones, and they're about 20 minutes. So it's not too demanding, and you can follow along and practice with them. And then I just linked that webinar that we discussed as well, if you wanted to get more information. So that's all on their website. And I'm going to leave that there because I feel like I see you all looking at that. So I'm going to leave it, but I am done with my part of the presentation. I have a few reference slides, so I'll leave this up for now. But if anyone has any questions about anything, I am happy.
Sarah, I'm interested in participating in this. Again, I am a person with Parkinson's. I'm in my 13th year, and I think lately my voice has gotten less clear. 3 months ago, I had deep brain stimulation surgery. And I think that has helped a little bit on the energy and the clarity, especially in the thinking and the cognition. But I don't know that it's improved my speaking voice. I live in Panama City Beach, Florida, currently, although my wife is considering taking a job back in Colorado Springs, so I would potentially be moving back there. How would one go about doing this virtually?
Yeah, so that is a good question. And one that probably doesn't come up that much. So it's important to know. So part of the reason they're doing this campaign to reach America and putting a therapy and research center in every state is because we are licensed. We can only treat in the states we are licensed in. But some of us are licensed in different states. We have a clinical educator who's licensed in New Mexico and somewhere else. I can't remember, California maybe, meaning she can treat people in those different states as well. I don't know if any of our therapists are licensed in Florida, but I do know that there is a therapy and research center in Florida. They're another, I don't know where, but again, virtually shouldn't matter. So I would be happy to reach out to my contact in Florida, and you could get set up there, because I don't believe any of our supervisors have licensure in Florida, but I can check. But there is definitely a therapy and research center, so it's at another university in Florida.
Yeah, it's probably down in Gainesville. Seems to be the center of most universities, things that relate to Parkinson's, at least.
That's not familiar to me. I don't think it is, but I can find out for you.
Okay.
Yeah.
Yeah, if you would please, I'd love that. I'll give you my phone number, my email, whatever you'd like.
I can take that, or if you want to give me a call at another time. I don't know if you want to give that to everybody. So
I don't care. What are they going to do? Call an old guy with Parkinson's? Yeah, my phone
Probably
number is
facilitate that
303.
too.
Yeah, I was going to say, Meredith will know all my contact information because I'm on the board with Parkinson's Point, but
Yeah, perfect.
um, yeah, if you want to just get that information from, well, you are Sarah. I forget the office manager's name. I apologize.
That's okay. I'm Steph or Stephanie.
Steph. Yeah,
Yeah.
Sarah, if Stephanie, I give you permission to give Sarah my email, my phone number, whatever Meredith has there for me. I'd be very interested in starting this. This seems more in depth and like it makes a little more sense than the Larry Silverstein. I understand what he tries to do, but just yelling for 20 seconds doesn't seem to me to make a hell of
Yeah.
a lot of sense. Whereas you sort of incorporate not only discussions about the cognition and the voice, and I think all of us with Parkinson's, the best slide you have on here shows the difference between autonomic nervous system and consciously having to think of things. And whether we like it or not, we Parkinson's people have to consciously think to do so many things, swallow, while we're eating and all those kind of things. I've done the beryllium test and all those kind of things as part of the stuff for the deep brain stimulation surgery. And certainly I need to, I have little exercises I do before I start eating, to warm up my body and kind of get ready to swallow and, eat much slower. It's much smaller amounts and all those other fun things. Thank you very much. This was very informative.
Yeah, absolutely. I'm happy to be here. And yes, I made a note and I will follow up with them as well. And we'll see what we can find for you. Okay. I know that they have services for you there in Florida.
Yeah. If I were to start here, but then move back to Colorado, I would come to your facility, at least for the startup meeting, and then I could do it virtually from there.
Yep.
If I lived in Colorado Springs.
Yep. If you moved, if you went through the program and were, let's say, in a group in Florida and then moved to Colorado Springs, we would just add you to one of our groups here in Colorado.
Okay.
That would be really easy.
Thank you.
You're welcome. Any other questions or thoughts from anyone?
Meredith.
If anyone needs to see or wants to know, here's some reference slides for you all. I'm always happy to send anything out anybody would like to see, any articles or journals, anything, but there's all my references.
Thank you so much, Sarah.
Of course.
We greatly appreciate it. Thanks for your time. Good to see everybody today. And we hope you all have a great weekend. So if you haven't already, feel free to go to the parkinsonspoint.org site and check out the emotional wellness series that's coming up September 7th. One of Sarah's colleagues will be joining us. I forget which Thursday it is, to give us some more tips and tricks around thinking skills and managing some of the cognitive issues that come up in Parkinson's. So there's more to come, more great information. So, all right, guys, have a wonderful weekend. Thank you again, Sarah. We'll see you soon.
Thanks for having me. Pleasure to see and talk with some of you.